right now. Please welcome Faust.
Probably put you forward, Steve. Let's put you guys just a little bit forward. So you guys there. You can see you. Sorry. That's over here. Sorry. Give you your space.
Welcome. Hi.
Thank you. Hi, Steve.
We were both on the same flight yesterday that where the toilets broke and we had to wait 3 hours in Chicago for a new flight.
After sitting on the plane for an hour.
After sitting on the plane for an hour.
Yeah.
We can commiserate. Boy, can we tell you stories. But let's start with the basics about the what is now called the Walgreens-Boots Alliance.
Yes.
And let's start with the portfolio brands that we're now talking about and how, and then we'll get into how that changes the game. So just give us the overview of where Walgreens is now and how it's no longer just my pharmacy or the place where I pick up my pistachios.
Yeah.
Well, I do pick up my pistachios.
They're great
You have
pistachios.
pistachios.
Yeah, absolutely. Yeah, so Walgreens-Boots Alliance is a global company that has presence around the world. I think many of you might know the Boots brand in the UK. Also, again, in Thailand and Dubai and South America and everywhere else. The big focus, though, and the change in a lot of the assets we have is happening now in the US.
And I think we have a slide that shows some of the main brands, so let's walk us through these.
Yeah, so Walgreens is making a transition here in the US from being just a retail pharmacy to being really a healthcare destination. And so one of the first biggest investments we made was $5.2 billion into VillageMD, and VillageMD is primary care. So we're in the process now of putting the primary care locations and co-locating VillageMD into our stores. We know that about 30% of the population doesn't have a primary care physician, and about 50% of these locations will be in underserved markets as well. We also have a 55% ownership in CareCentrix, and CareCentrix focuses on post-acute care, as well as the transition from hospital to home and really preventing readmission. And then Shields is very much known for specialty pharmacy, and specialty is growing leaps and bounds, and they do a brilliant job in customer experience there as well too. So we've got an investment there. And the intent here now is really how do we shift from fee-for-service models to partnerships and sharing in a risk model? And again, how do we share data? How do we better care for the patient? And ideally lower total healthcare costs where we can all benefit in the savings.
And the frame for this discussion is that you are really redefining who your customer is, because you're moving from a pharmacy customer mindset to a holistic patient mindset. And COVID was sort of one of the accelerants for this, because suddenly all Walgreens, as my local one did, suddenly became a center for treatment.
Correct.
In a way it never had been before.
Yeah.
So tell me explain or walk us through that basic shift in definition of who your customer is and what you learned from COVID that's helping to drive this change.
Yeah, so I think there was a change two ways. I think one was the way the customer saw us, right? And so I think people often forget that pharmacists are healthcare professionals. They've got 6 years of education, they graduate with a doctorate degree, and we failed to let them practice at the top of their license because dispensing has always been so profitable. And so I think when COVID hit, patients started to see us in a one-to-one setting, in a clinical setting, and again, had the opportunity to be educated, to ask questions, to get information, and to be vaccinated. And so I think patients begin to trust us a little bit more. And then the flip side of that is we learned a lot from patients who were coming into the store around the questions that they had, and understanding that it wasn't so much about just putting a needle in somebody's arm, but understanding the impact of what that meant to their total life. And so we have started to focus on the fact that, we know now, when COVID hit, we knew that some communities were impacted much more greatly than others. And so we thought, well, is it just because they have more underlying health conditions? And the answer was no. They are impacted by their quality of life, their financial, their environment, their access to care. All of these things started to play a role. And so when we looked at it deeply, we realized that 80% of health outcomes are determined by social determinants of health. So for us, we now look at the patient through the lens of all of those things, down at a regional level, a zip code level, and where we can, even an individual level.
And this, and you mentioned zip code, because this segues into the next point, is this creates a tremendous new data challenge.
Yeah.
Now you're talking to a much wider audience.
Yeah.
You've realized through COVID, I think, that that the customer attitudes towards healthcare are extremely complicated.
Yeah.
Things like vaccine hesitancy,
Yeah.
like underserved communities.
Yes.
You suddenly have to reach different people than you ever reached before. Take us inside that, because there was a real major data transformation at Walgreens that had to drive this.
Yeah, absolutely. And you're right. We had never done anything like this before. Nobody had. So there was no playbook for us. And not only were we dealing with vaccine hesitancy, but we had to cut through misinformation, disinformation, political beliefs, all of those things. And so we looked at data very, very differently than we had previously, and created some new data models as well, too, to better understand who needed to receive what message and when. And that was very dynamic. So I think for me anyway, this was the first time I really saw our media and marketing come to life in really helping to ensure that we were getting the right message to the right customer at the right time. And the data sets that we started to look at and the algorithms and the models that we were building were quite unique. And it actually turned into one of the most successful data-led campaigns in the world.
And I know you're not intimately connected with all of that stuff, but take us inside that profile a little bit more deeply, because you needed to address attitudes towards healthcare,
Yeah.
Towards demographics and audiences. Tell us a little bit about how your profiles changed, the kinds of data you were looking at, and
Yeah.
the things that you were doing differently.
So Steve, I'm going to cheat a little bit because
Okay.
I talked to the team and I wanted to get all of the numbers from
Okay, cool.
So here's what they said.
We love numbers.
We leveraged 135 data features and machine learning. We used more than 35 search queries to isolate demand variables, created 7 groups by clustering each DMA and likely demand, created a forecasting model for each cluster, and then used a gradient-boosted decision tree algorithm to identify key drivers in vaccine readiness. We layered on store information, pulled from audiences within a 5-mile radius, and I'll include too that 75% of the US lives within a 5-mile radius, which is why we picked that number. And then the model created 21 localized segments from vaccine ready to vaccine hesitant, serving up the different messages at different times to maximize appeal. And they said that we outperformed traditional third-party audiences because we were able to account for changing hesitancy in real time within specific populations. And so all of this resulted in, here's some great numbers, I think, 47% increase in engagement, a 43% increase in appointments, and a 20% cheaper cost per appointment. We had also had a stretch goal of 30 million vaccines by the end of August of 2021. We hit 35 million, and we're now sitting at about 68 million vaccines delivered. And I don't think we could have done any of this, again, without the media and marketing that was put behind it.
This is an amazing story, and we've actually told this part of this story in other events, because it really speaks to how right now we're going through this tremendous fear factor when it comes to data and the way it's being used and collected. But here's this amazing story about the ways in which that same data was used to do things like predictive modeling and profiling and targeting to actually find people who needed information and to serve it to them in a you call it mass personalization. Why don't you tell us what mass personalization is?
Yeah, so I think, you've kind of identified it, right? Is how do we identify these groups and provide them with a level of personalization, again, across a group, but for that person feels quite personal because they're receiving, again, that right information at the right time based on, again, the things that are crossing their mind in this moment.
What did it take internally to do that? What changes had to take place in the way you organized and used data, gave people access to data throughout the organization so that could happen so quickly?
Yeah, so I think, again, I don't think anything else could have moved us as quickly around how we use data than knowing that we played such a big role in kind of getting the country back up on its feet. And so I think we were a bit, we tend to be quite risk averse. And I think knowing what was at stake, the company really came together to say, what is the right thing to do here? What are the right data points to share? And what is it that we're truly doing for the customer? And so across the board, every part of the organization was focused on this. How do we reach the people we need to reach at the right time and get them into our stores or get into their communities so that we can get shots in arms.
Were there any internal reorganizations that had to take place for this to happen, or different ways in which different silos were communicating?
Yeah, so I think the walls just came down completely, right? And so a really high level, I wouldn't call it formal restructuring, but certainly cross-collaboration that was happening on a daily basis. There were, every group, legal, privacy, data, IT, pharmacy operations, B2B, all of this was together in these daily meetings with 150 people talking about what's next. Again, what data do we need? What infrastructure do we need? All of those pieces. And so it was rather informal, but we did it.
And one important insight, one part of the profile were the underserved communities.
Yeah.
Those who are either outside of health insurance, who are underserved or underinsured,
Yeah.
Or who are just healthcare averse.
Yeah.
And that seems to have been one of the things I'm reading is that out of this, as Walgreens sort of decided that that's going to be part of its identity going forward and an important part of its investment, especially in its on-site care. So tell us, first of all, how you came to that insight and what the marketing plan is now.
Yeah, so as I shared, when we started looking at the communities that were hit, we quickly discovered that the ones that were hit harder were greater, had a greater impact on those social determinants of health that were causing that just mass inequity. And so right from the beginning, there was a decision made around our marketing and media to say that we are absolutely going to focus our message on equity and information. More so than any of our competitors, more so than any other media that we did, but we said this is the message that we wanted to hold true to. And one of the reasons for that is as we looked at our footprint, 60% of our stores are in underserved communities or those that are considered high on the social vulnerability index. These are the communities we serve every day. And so that's the reason we chose for that focus. And it also really aligned with this direction of where we wanted to go in terms of being, making healthcare local. These are the communities that needed it the most. And so that's the catalyst for that.
I want to tease out, because I mentioned it in the opening, and it's something that's impressed me as I've talked to everybody for the next few days, is that local connection. Are there particular ways that you've learned about how to leverage the people on the ground that people really are connecting with where you were, where you started, right?
Yeah,
in the
absolutely.
pharmacy. Tell us a little bit about what you guys have learned about how you leverage and activate your all of those thousands of Walgreens pharmacists and
So I think pharmacists in general have always been one of the most trusted professions. And again, we've seen it, especially with those customers that need us the most, the ones that tend to get 8 to 10 prescriptions per month, that have several underlying health conditions. There's just a high level of trust there. What we realized with COVID is we've already got some customers who trusted us, but we needed more trust within the community as well too. And so we started to work, again, not only in terms of marketing and media with local, but how do we also get our pharmacists out and working with other trusted people in the community? So whether that was pastors or whether that was people in political office or whatever that looked like, we got out there and started having more conversations and often brought vaccine to them instead of bringing them into our stores. And so whether it was clinics that were on a church Sunday afternoon or whether it was a mobile bus that we brought in, we did all of these things to really kind of understand directly from key players in the community in terms of what specifically was impacting that community or preventing that community from getting vaccine. So what were the issues around hesitancy? And again, what were some of the other blockers? I think, we realized that transportation for so many was a huge barrier. There were people who absolutely wanted vaccine, but had no way to get to us, right? They're in a pharmacy desert. And so that's one of the reasons we had a relationship with Uber to provide 10 million free rides for people to get in, right? And those were things that we also had learned from our pharmacists as well over time, is that a lot of our customers take a bus to come get their prescriptions or are dependent on somebody.
Did you have to implement a new type of feedback loop? Infrastructurally, what did you have to do to make sure that you were getting that feedback from the local
we absolutely did. So back in 2018, we'd created something called the Patient Care Portal. And what it was designed to do was to, again, use data and predictive modeling to determine who was most likely at risk to become non-adherent. And what was happening in there is, we had our data and we would put things in there and we would surface a list of patients to the pharmacist. And the pharmacist would outreach, have a conversation, and they learned a lot about what was happening in their community. But the solution was was done by that pharmacist specifically. So if somebody had an issue with cost, they would then go out and try and find ways to find them savings, but they would do it on their own. And we weren't quite aware of what was happening there. And so what we did was we embedded this feedback loop in the patient care portal to start to really understand what was driving each community in terms of barriers to care. And then we were able to use that as well too, not only for COVID, but also now as we think about, managing disease states as we move forward.
And you're doing a lot of phone calls every month.
We're doing 10 million.
10 million
We
phone
speak to
calls.
10 million
That
patients.
really
Yeah,
impressed
not
me.
just phone calls, it's even more than that. So it's 10 million patients that we connect with every month
Right.
to have a conversation around their health.
But again, that human layer, throughout all of this automation, we just moved from this
Absolutely.
incredibly data-driven predictive modeling piece to a very human piece,
Yes.
and then finding the ways in which those merge together is really what's going to move
Yeah.
this forward.
And Steve, that's where we get really personal, right? Because that human conversation gives us really specific information about the person that we're trying to help. And that goes back into, again, the data and allows us to be even more personalized.
And I would claim it also inflects in the ways in which they receive the automated, personalized stuff.
Yeah.
They know that somehow a human contact went into that, even though it's an automated email.
Correct. Yeah. And we'll often, with our health outcomes pharmacists, we'll have that conversation with the patient and to say, look, you're going to receive an email that's going to have some of these things that we talked about and give you
Right.
the links to things that you can do to help, right? Again, whether it's around transportation or cost or other barriers or just information around your disease state.
I want to bring up the next slide because it shows us a little bit about the different ways in which you're talking to different constituencies. This may be a little hard for you to see.
Yeah,
But
sorry,
we'll
I was
post
trying
it.
to fit everything into the.
But just sort of describe the differences here in this. This is mass personalization.
Yeah, so again, this is where those models really came into play, and what the types of messaging that we were surfacing for those, again, that were vaccine hesitant, all the way through to early adopters, and what was the right message that we needed, right? And so this changed so frequently, again, based on what was happening. And like I said, because we had so much real-time information that we could include in that model, our messaging consistently changed. But again, we had just tremendous results. And I think, again, one of the things that I was most proud of is that 2/3 of all the vaccines that we have administered have been in underserved communities, or again, those that were high on the social vulnerability index.
This was an amazing test of predictive modeling and the flexibility of data because you really had customers, patients whose attitude towards the vaccine were changing in a real-time way,
Absolutely.
and you actually needed a way to model that out.
Yes.
So that you were talking to them at different stages in their evolution. That's
Yeah.
That's amazing to me.
Yeah.
I have to throw you one quick
Sure.
curveball as a customer of
Yeah.
Walgreens. So before we get into building trust and the John Legend spot, what I want to talk about, as a longtime customer, I think of Walgreens as my pharmacist.
Yeah.
I think of it also as my pistachio source.
Yep.
My wife stops there every day on the way home from work and picks up her, her vitamin water
Sure.
and her pistachios.
Yeah.
It is both, for us, longtime users, it is both sort of small convenience store and pharmacy.
Yeah.
I'm curious, since you're the patient experience expert, how does the look of the place, does the experience of walking into Walgreens have to change as you start moving towards this more patient-focused
Yeah.
view? Are you starting to think about, what's my experience going in? Does it look like a grocery store, or does it look like sort of a Mediquick place?
Yeah, it's a great question, and we are certainly experimenting, I think, with a lot of different layouts. I don't think we want to give up convenience. I think that's still really important to us, right? And whether it's convenience around healthcare or convenience around some of those needs you have, whether it's pistachios or beauty or whatever, we want to keep that alive. I will tell you that as a pharmacist, it drives me absolutely crazy that we sell cigarettes, right? And I hope that goes. Or the fact that, we're okay with selling chips and soda pop to diabetics or giving them offers to buy those things, right? And so I think we'll be smarter about our selections that we have. We'll still be convenient. We'll still have those things that you need, but we'll be more in line with
That's interesting.
Health.
It'll actually impact the product mix. That's
Yeah.
interesting. Okay, I want to talk about trust, and I want to talk about the big campaign, because everything you're talking about here, in terms of the kinds of modeling and messaging that you're doing for your patients and talking to them more holistically as patients rather than pharmacy customers, is really, it requires upfront trust.
Yeah.
In the brand.
Yeah.
And I want to talk a little bit about how you gathered and built that trust.
Yeah. So a couple of things. One is, I think you saw a real shift in our messaging, right? Again, across all of our media and marketing, with our desire to focus on equity and on information, we built a tremendous amount of trust with the communities that we were serving. And so I think that was big, and you'll continue to see us do that, right? I think the other thing, too, that I'd mentioned is our pharmacists already had a lot of trust. But the great thing was, as we got them one-on-one in front of patients, when we looked at the most trusted professions, we saw a 7-point jump in how much people trusted pharmacists as a trusted profession. And so now we need to continue to leverage both of those things. Again, really smart media, making sure that we're meeting the needs of the patient, but then also ensuring that our pharmacists actually have the time to continue to build out those relationships. Like you talked about, that human layer has to exist.
What are the key trust metrics for you? Are there particular numbers you look at that you
Not
do a sense?
yet. So it's one of the things I'm absolutely pushing for, right? Because you can measure loyalty and retention and things like that. But I think there's more that we can do. We've been a very operational company. And again, very focused on dispensing and how many prescriptions we fill and how many patients can we keep adherent. And I think that's part of the shift we're making as well, too, is what are the key things that we need to start measuring to understand loyalty, trust, and ultimately, can we actually influence health outcomes?
We should set some of our sponsors in the room who have been dealing with data and coming up with this kind of profiling for years. We need a trust metric now.
We do. We do.
Speaking of which, let's talk about the John Legend spot, because I think in many ways the John Legend spot sort of brings together a lot of the themes we've been talking about, the changed branding for Walgreens, but also focusing on communities, hesitancy, changing attitudes, and trust.
Yeah.
Do we want to show the spot first and then you talk about? All right, let's show the John Legend spot that they used. I want to find out a little bit about where all this ran. And then on the back end, I want to talk about what went beyond it, what went into it.
This shot is our shot. The COVID-19 vaccines are ready, and so is Walgreens, with pharmacists who you who know you. So when you're ready, they'll be ready to give it to you safely for free. This is our shot at bringing our communities back together, providing healing, not just for some, but for all. This is our shot. This is our shot. This is our shot.
Why him? Why this message?
Yeah.
And what impact do you know it had?
Yeah, so I think the organization really thought through, do we need a partner? Is there a message? Who's the right person for this message? And we knew we needed to reach the Black communities and the communities of color. And John Legend clearly is, equity is something he's quite passionate about, or inequity. And so they had, again, great conversations with him. I don't need to tell anybody in the room how expensive this was for us to do. But he influenced our messaging, right? He brought in some of his own media people as well, too, because I think it's quite candidly when you have people that aren't of the Black community trying to put together a campaign to reach the Black community, it doesn't always work. Right. So he was able to influence that as well, too, and it was a very, very successful campaign, right? So the day we launched, we reached $1 billion. I think it was a 53% open rate, and again, delivered both revenue and EBIT. For us. So it was a brilliant campaign, and again, we saw a surge in vaccination rates as well.
Okay. So you actually did see a tangible impact after
did.
this in the communities you were targeting.
Correct.
I want to. By the way, we're going to pause. I'm going to do a quick lightning round with Fauz, and then we're going to open it up for questions. She'll also be leading a roundtable on customer experience at the end of the morning, so you have the opportunity to dig in deeper. So prepare your questions. But here are my quick lightning round questions.
Okay.
What are the key things you know now that you didn't know 12 to 14 months ago?
It's a lot. So if we start with the customer, I would say that the customer needs so much more from us than what the retail pharmacy provides, and that they trust us to provide that more. So as we go into this new healthcare role, we're meeting a need, and it's a need that the customer actually would trust us to deliver.
What have you learned about making internal changes?
It's hard.
Quickly. Well, okay. Yes,
Yeah.
It should be.
Yeah.
But what have you learned about doing it? What worked in doing it? What were sort of the key things that made it
Yeah, so I think every time Walgreens is up against a really big challenge like this, we do it really well. But as I think, as we start to work towards this transition, this is a combination of, and again, even we did this with COVID as well too, you've got to keep kind of that core business running, and that profit machine running, but you've also got to be willing to take risk and challenges and delve into the new. And so I think really good leadership and internal company balances those things really well, right? And again, you saw it on the slides, the amount we are investing now in media, right? In understanding the reach of who we need to serve, and again, the specifics around the messaging. But we're still a 120-year-old company, And so helping to leverage all of that trust and that history, but still make it new and relevant.
What are the channels that are proving most effective?
Yeah, it's a great question. So I think it's all the channels work for us, but at different times and in different places for different audiences. And in some instances, I thought it was really interesting is when we took our mobile bus out, so we had a mobile vaccine bus that went into communities, again, that were underserved. We worked with local, again, just to promote, but the minute we added any sort of additional media or marketing around it, there was no additional lift. So I think it really varies on what we're doing. Clearly, these big campaigns had a huge impact. And so I think you'll continue to see us leverage all of it at every level.
But a lot of the stuff, like the visual ads that we showed, were going on in some what otherwise might be considered mundane channels, display advertising and email.
Yeah.
And they were really effective in getting the message message across.
Yeah.
We have time for questions. If you have a question, raise your hand, stand up and tell us who you are and who you're with.
Don't be shy. Here we go. Down front.
Hi, I'm Stacy DeZiel. I work for Acuity Ads. And first I want to say thank you, because it's amazing that at a point of crisis in America that a corporation can come together and do so much good. So my first question was, especially when you're referring to the call centers, did you have to change your privacy policies much as related to how you were capturing such personal information and then integrating it into your marketing stream?
Some, yes. Now, because a lot of what we were gathering is, again, part of that pharmacist conversation, right? We were then able, and because the pharmacist was mentioning the follow-up that would happen, right? We were able to do that. So we had clearance from, again, privacy and stuff as well, too. It wasn't so much mass as it was individual.
Great. And then I had a second question, because you talked several times, and you might have mentioned it in the partnerships, and I might have missed it when you went through what the partnerships were. But because in many of these communities, the pharmacist is the trusted advisor, how are you working with local physicians from a diagnosis standpoint to push them back to their physicians in the community?
Yeah, so that, Stacey, is a really hard one for us. So we're, to your point, what we found in a lot of underserved communities is that they trust the pharmacist more than they do the hospitals, the clinics, things like that, right? And so it's one of the reasons we're actually bringing VillageMD into our stores, is to create a primary care provider relationship, right? Now, we're still working through all of the data and how we do that, but one of the things we've done is we've actually embedded a pharmacist into the VillageMDs. And so they become part of the care team, which allows us, again, a bit more of that data sharing to happen.
What's the pace of the rollout for actually bringing the VillageMDs into the existing?
Yeah, I think we'll be just over 200 this year and over 600 by 2025.
And is that going to be sort of a unified marketing plan? Is it all going to be coming through Walgreens, or are you trying to build up the VillageMD brand separately?
Both.
Okay. Fauz, thank you so much. This was
Thank you.
really interesting stuff. Thank you.
Thank you.
Thank you so much.
Appreciate it.